Hi guys, it's Dr. Dawn here, your board certified OBGYN. I am here to help women all over optimize their personal health. I'm back here again today. We're talking about conversations or having conversations on contraception. So, again, Dr. Dawn, OBGYN, board certified, here to talk to you about contraception. When you think about contraception, or when we talk about contraception, oftentimes we're just thinking about women. But I think we should include the guys on this. Men, you are included in our conversation. Why? Because typically, unless you're getting help from a doctor with in vitro or things like that, men are included. They're helping us get pregnant. So it's important that guys are just as aware of the contraception options as women are. If there are partners, we're in a relationship, whether it's casual or more serious, we need to have those conversations with people or with each other. A lot of ladies aren't as aware as they could be with contraception. So if the guys are also aware, you all can talk about what you're on, what symptoms you're having, and the guys might actually help us to figure out what's best for us. At the very least, you need to have a conversation just to know, guys, that the woman is on something. Typically, if you are using a condom, you make the assumption that the young lady is doing something or using something, and she may not be. So have a conversation with your partner, and let's figure out some good options for birth control. So thank you guys again. I see we have people coming on board. Like the video if you can. And again, Dr. Dawn, OBGYN, here to have a conversation on contraception. This is a continuation of our piece that we're doing. So the last time I was here, we talked about the birth control pill. And those are pretty familiar, that most people know you take a pill every day. But what I wanted to do was tell you about some cousins of the birth control pill. So they're the contraceptive ring and the contraceptive patch. What they're doing is trying to give us more options that are not something you have to worry about every day, but they give you the same effect as a birth control pill. So we know the birth control pill acts to stop or hinder ovulation. And so the vaginal ring is actually a little small ring. It's like, it looks like a little bracelet that we used to wear back in the day. Very pliable, it's clear. If you're comfortable with using a tampon, you should be comfortable with using this. So you take it, you squeeze it, place it in the vagina, push it up as far as it'll go. It kind of settles in the right area. And with our contraceptive ring, you place it in, you wear it for 3 weeks at a time. And the directions are to take it out on that 3rd week, and then on that 4th week, you'll have your menstrual cycle. And at the end of the 4th week is when you will put in a new vaginal ring. Well, what you can do, and what I used to tell my patients, you can leave it in for 4 weeks. You'll have a lot less bleeding, and at the end of the 4 weeks, just take one out and put another one in. Because what are we trying to do, ladies? We're trying to increase or decrease the chance of us forgetting to put that ring back in, because that does happen. So leave it in for 4 weeks if you want to. Take it out, put another one in, you're good to go. All right. Now, something similar to the ring is a contraceptive patch. The patch is probably about that big. It looks like a Band-Aid. And it acts like a Band-Aid. So you put the patch on a week at a time. You can put it in your lower abdomen. You can put it on your buttocks. You can put it on your arm. You don't want to put it on your breast. So you put one on a week at a time. I tell ladies, put one side, the other side, put it on your buttocks. And then again, that 4th week, you don't wear a patch, and that is when you will have your menstrual cycle. All right. So we talked about the contraceptive patch, and we talked about the contraceptive ring. What I also would like to include with this is the extended birth control pills. So let's say, typically we are on the pill on the 4th week is when you will have your menstrual cycle. But they're not really that fun to have all the time, depending on what you're going through. So they have pills out now that are extended. So instead of having a menstrual cycle on that 4th week, every 12 weeks you have a menstrual cycle. So it's the same setup. Instead of getting one tray, it has 3 trays. And that last week is when you'll have your menstrual cycle. So on the 12th week. So that one is good. If you don't want to have a cycle every month, you can have it every 3 months. What you do have to look out for that one is you typically if you skip a pill or even if you take a pill every day, sometimes we have more vaginal spotting or bleeding, irregular bleeding with that. So give it a little time because that will improve after you've been on it for a little bit. And the other one I wanted to talk to you all about is emergency contraception, because even, you know, the best made plans, sometimes we still have problems that come out of it. So with the emergency contraception, it's usually called Plan B. It is available at the pharmacy without a prescription. Now, I would call ahead because some pharmacies carry it, some don't. So call ahead to make sure that they have it. It consists of a pill. It's just a progestin, and again, it acts to stop ovulation if you've had unprotected intercourse and you're worried about pregnancy resulting from that. So the key is you want to take this pill within 3 days of having the sexual act. At the very least, 5 days. For it to be really effective, 3 days is best. You can go out to 5 days, and the efficacy is about 85 to 90%. So that's something to keep in mind. If whatever happens, you use a condom and it's not working, or something happens, you think about that emergency contraceptive pill. You also can use, if you're on the birth control pills, you can use 4 or 5 birth control pills, and that will do the same thing, but you tend to get a lot more nausea with that. So talk to your doc about that. So we went through the birth control pills, extended pills, the emergency pill, contraception. What I'd also like to talk to you about are some other ones that are available: the contraceptive injectables and the contraceptive implantables. So the contraceptive implantable is just a little rod. It looks like a matchstick. It has the medicine inside of it, and they usually will put it on the inside of your arm there. The cool thing about that is you can leave it in for 3 years. So typically we'll use, my younger girls will use that because they know in the next 3 years either they're in school or they're working and they don't want to get pregnant. So we'll use it in implantable. Again, it's high dose progestin, stops ovulation, but with that medicine you can get the irregular bleeding, you can get some mood changes, mild depression. Some ladies get acne with it. The other thing that you'll get a lot of, or some ladies get a lot of, is the irregular bleeding, unpredictable bleeding. So you'll bleed even when it's not time for your menstrual cycle, and that could be problematic for some women, but definitely think about that. So the implantable is something that your doc puts in the office and takes out in the office, but put it in, you're good for 3 years. If you want it out before 3 years, you come in and your doc can take it out. Okay, that is the implantable. And then we also have the injectable. The brand name is Depo-Provera. It's again high dose progestin, and it's a shot, that you take every 3 months. And again, it's for that lady who really doesn't want to think about it, but definitely wants to use something. And again, this one is sometimes I use this more with my younger girls because they're not necessarily going to remember to take a pill. So we use the Depo-Provera, the shot, with that. Side effects with that, main thing you want to worry about, you can have irregular bleeding. We also have we have to concern ourselves with decreased bone density. So bone density comes into play if you think about it. If you're walking, let's say you're here in Chicago with me, with all this ice on the ground, you fall, you have a higher chance of having bone fractures with falls and things of that nature if you have less density in your bones. So we have to be careful in terms of how long we keep you on this medicine, and sometimes we'll give you some other another hormone like estrogen to supplant that medicine. So you can worry about the bone density, you worry about irregular bleeding. And you also have to be concerned about how soon your fertility comes back. Sometimes it'll take a while for your cycle to come back on a regular basis. So I tell ladies it could take anywhere 6 months, 10 months, a little bit longer. So let's say you're older age and you know you want to get pregnant in the next year. I probably wouldn't start you on the Depo-Provera because you will have a lag in terms of how soon you'll be able to get pregnant. So those are the main things we think about with the Depo-Provera. Other complaints I get with my ladies, some ladies it causes hair loss. Not everybody, some ladies though. Some ladies you can get some weight gain. So I tell my ladies, if you are sensitive to weight gains or losses, this is not the medicine for you. Doesn't always happen, but it can happen because it increases your appetite. So with that increased appetite, you're eating more, you're going to gain some weight. So if you are concerned about that, really be strict with your exercise plan, or maybe you want to do the pill. This might not be the one for you. So again, we've gone through a long list of some options for you. Hopefully this is something that will increase the knowledge in terms of what you want to use. Ladies and gentlemen, this information is something for all of us. And if you have questions, let's see, do we have any questions? So far I don't see any questions with you guys. I was born in the 70s. I'm a 70s baby, so I'm not the best with all of this newfangled Facebook stuff. So you might have left a question and I didn't see it yet, and forgive me, because my sister and brother had to set up my account for me. I don't do those things. But having said that, I have improved lately. So if you want, I have an Instagram page, I have a Facebook page, I am also on Twitter. So like those pages, go to that, follow me, Dr. Dawn OBGYN, on both Twitter and Instagram. Like my page here on Facebook. On my next conversation, I'm gonna figure out how to get to your comments, because I want to answer questions if you have it. But let me know, instant message me if you do have questions. If you have topics that you'd like me to go over, I have buddies that have already created a list for me to go through for them. So I'm sure if it's something they're interested in, is something that the general population would be interested in as well, and I'd be happy to do it. So again, Dr. Dawn, your board certified OBGYN. We just had another conversation on contraception. I really think we went through all of them, so I will find another contraceptive piece to do with you guys. But like my page, and I'll see you soon. Thank you.